Hello, Steve. How are you, man?
Bit nervous, Focko, but I'll be all right. I'll be all right. Once it starts,
Yeah,
I'll start relaxing. I'll be fine.
that's just it. We made it, man.
I know it's been a long time
Yeah, we're literally
coming.
looking forward for it. And first of all, let me thank you so much for being here. It's a honor and a pleasure to have you here.
Thank you.
And let's just start, and then you are a mental health support worker for one of the biggest teaching hospital, NHS hospital in London. Correct. But before we start to talk about your current job experience, I would like to talk about your past experience, because apparently you used to do a couple different jobs.
Yeah. So my name's Steve Bedford. I'm 43 years old, and I've been doing mental health work now for 10 plus years.
Wow.
But before that, I was when I left school, I did building work. Then when that dried up because of the recession, I went into security, and I happened to get a job at a hospital in London, a psychiatric hospital, and one of the roles there was to deal with psychiatric emergencies and things like that. So I would go to these emergencies. They could be staff attacking, patients attacking staff, patients fighting each other. Could be all different scenarios.
In a mental health hospital.
In a mental health hospital, yeah.
That
And
was
then
quite a big change, yeah, from building jobs to security mental health hospital, isn't
it
it?
was an eye opener.
How did it feel like to find yourself in all that type of environment?
Yeah, it's I suppose it's a team you've got around you. So if you're comfortable with the people that you got around you that are going to be going into the situation with you, it does help. But obviously I've been in situations where I've not felt comfortable, and we've had to sort of think on your toes and deal with situations. But as I said, I was security, so I would go to these places, emergencies, and I would get people would say, "Steve, you're so good at calming people down."
Yeah.
Or de-escalating situations.
Okay then.
Why don't you become HCA? So that's how I got into the role.
So right, about your experience as so you used to be security. How would you deal with emergency when some emergency happen? How would you just calm people down, and how do you deal in this situation?
I suppose every situation was always different. So first of all, we'd have to go there and obviously assess the situation.
Okay.
And the good thing I had going for me is a lot of the people that you're dealing with come from similar backgrounds to me, i.e., they come from council estates.
Yeah.
They had very little or no education, and we all spoke the same. So, and you can't fake that, you can't fake that. So when I used to go to situations, I suppose they would hear me, and I suppose they knew that I was genuine. It didn't work every time, but
yeah, of course. I mean,
a lot of times it did work. So that would be like a little feather in my cap. And most of the time they would come from areas that I knew. So you could sort of like build up a bit of a relationship with them by saying, "Oh, I know the area you lived in. Do you know this place? Do you know that place?" Take it from there, and hopefully you build up a little rapport.
I try to escalate the
Absolutely.
crisis situation.
If if you're talking to them, hopefully they're calming down, and then obviously you assess the situation again, and then you take it further and see what else needs to be done. Do you know? But it's challenging. It's challenging.
Cool. I would like to ask you, what are you most passionate about this field you're working with?
I suppose it's quite a good question actually. I suppose it's the end result. So like when you see somebody come in and they are, very suicidal, very depressed, whatever the situation is that's brought them into hospital, and then you work with these people for, sometimes it could be weeks, sometimes it could be months, and then you see a change in them. So when they first come in to when they leave, that's the satisfaction that you get.
Yeah.
But the problem we have is that people come into hospital for all sorts of reasons, and they stay in hospital and they're away from the environment that has made them like that, whether it could be a home environment, a social environment. They come into hospital, we get them well,
Yeah.
and then we put them back to where they come from.
Fantastic.
And
Does
you-
it always like?
We wonder why people fail. Do you know what I mean? Because they've come from this environment, and then we're going to put them straight back into this environment after we fixed them. Do you know, it's very difficult. Do you know?
So as you say, you used to work as a security guard for a mental health hospital in London, and do you remember any like a crazy situation escalating whilst you used to work as a security, like some crazy smashing and punching people?
One situation I remember, we got called out to a psychiatric emergency,
Okay.
and it was me and my colleague we were the first people to turn up. And when we walk in, we see this man. He was massive, like 6'4",
Wow.
and he was the same wide. He was a big man. So when we walked in, I can laugh now, but at the time it was like quite serious. There's one
Yeah, I can
doctor
imagine.
knocked out. Oh, he's Sparko on the floor. He ain't moving. Do you know what I mean? And there's another doctor. I call it the chicken dance. So he's clearly been hit, and he's wobbling. He's all like this. So we thought, oh my God, So we grab this man and we get him against the wall, and we're trying to get him on the floor. It ain't happening. Do you know what I mean? Like, it's not happening at all. So we just had to. We're both really nervous now, thinking if this geezer gets out, he's already like knocked 2 people out. He's gonna hurt us. So we just had to basically hold him until other people come. Then we could take control of the situation.
Yeah, you may call for backup if.
But see, backup's always coming, because within the organisation that I worked in, every shift people are designated to hold the radio. So that means any emergencies happen within their designated area, they will always respond. So you're always going to get a number of staff turn up. Unfortunately, they don't all come at the same time because they move from different parts of the hospital. There's all sorts of reasons that people don't get there on time. Do you know? But we didn't have no choice, because obviously there's one person's unconscious and there's another doctor chicken dancing.
Yeah.
So we had to sort of go in there and help him, because it could have turned into a different situation.
Yeah, very, very serious one.
Absolutely. Someone can get hurt, and this is the thing. People do get hurt. Do you know what I mean? People, unfortunately, have lost their lives. Do you know?
Wow.
And this is the environment that you're walking into every day. I used to have the mindset when I used to go to work. I used to be expected to get hit every day. I used to think I'm going to get hit every day.
That was your mindset.
That was my
literally.
mindset. So when it did happen, I could deal with it, because I know people that go into work who don't want to get hit, don't expect to get hit. When they do get hit, they fall apart.
Wow.
Bless them. Do you know what I mean? It ain't their fault, because then they haven't registered. Do you know?
Yeah, you need to have that state of mind, especially as
Absolutely.
your position as a guard. So
I used to think every day expect to get hit.
Yeah,
And when I didn't get hit often, but when I did get hit, I already prepared myself mentally to deal with it.
oh yeah, another day has gone by.
There you go. Do you know?
Wow.
Yeah.
And I would like to ask you, obviously as a security guard, you need to operate within like certain legal limits. Obviously, if you get punched, you're allowed to defend yourself, or obviously you're not allowed to punch back if you get hit. How does it work,
See,
literally?
The law, it's a very funny law. It's very complex law. See, you can defend anybody can defend themselves. You know, you can defend yourself. Sort of like, if you're coming towards me in an aggressive manner and I feel threatened, I can hit you. Then have to restrain you till police come. If I hit you, then keep hitting you. That's an assault. Do you get what I mean?
Yeah.
It's it's called justifying your action. So you have to as long as you can justify why you've done it. It's very difficult to justify it though in the eyes of the law if you've really beaten somebody up. Do you know what I mean? So the law's very sketchy. It's a very difficult law. You've got enough people there as a witness. Do you get what I mean? So I've done it for 10 years and I've never seen liberties taken. I'm not saying that liberties don't get taken, but I've seen more staff hurt than I have patients. Do you know?
Because obviously you're not allowed to like restrict patient and anything just like that. You need to wait for a situation to escalate in order to. react or like take actions, if you know what I mean, like
course.
physical action, literally.
See, we always give people options. You know, like, say for example, if someone's refusing to take their medication and they need to take their medication, then you can IM them. Yeah, it means an injection. But obviously, your first port of call is always going to be to offer the person oral medication. You know, take oral medication. And like, I've been in situations where we've been talking to a person for an hour and a half, and then they've agreed to take their oral medication.
Oh,
Do you know what I mean? They've got two options. You take it orally, or you will be restrained and you will have a needle. I'm quite frank and quite like honest with them, and I think that's what's got me a lot of respect with people as well, because I tell them, you know, these are the facts. You can sit there and say it ain't going to happen. It's definitely going to happen. You know, it's people hang up, you know, they want to show their strength or whatever. It's not about strength or anything like that. You know, if you need to take your medication and you're not taking it, you will take it one way or the other, you know. And
so are they not like allowed to refuse the medication if they treat it as under mental health sections?
no, if they're a section patient and they are prescribed medication that the doctors think they need to take medication to help them with their mental health, yes, then they can be. If they're refusing to take the medication, then yes, they can be restrained and IM'd.
Oh,
You know,
wow.
yeah.
So now we jump to your healthcare assistant jobs.
Mm-hmm.
And you used to work in a forensic unit, if I'm
Yeah.
not mistaken, which is a department who deal with the people who's got like they had some background dealing with law, with police.
So
And
yeah, the forensic services, they could be prisoners that the prison service think need to be assessed for mental illnesses, or it could be patients that are basically too unruly in a normal setting, so they need to be in a forensic setting because they're, you know,
yeah.
they kick off all the time, or they abscond, or they fight all the time, whatever the reason may be, you know. So yeah,
So now, obviously, from a security guard, you jump into healthcare assistant jobs. And can you describe your daily routine as a healthcare assistant in a forensic unit? How did it feel like from a security to a healthcare assistant? So it's a kind of a different job because you're going to have a more contact with the patient. If you know
Yeah.
what I mean, it's kind of, you need to literally deal with the family, deal with them like on a daily basis. You know it's gonna be just a call out for support as a security, but you just literally needs to be there, dealing with them, giving personal care or stuff like that.
Yeah. So I
Please
suppose that
explain your daily
side of
routine.
it was different. In a lot of similarities, because they, on the forensic walls and on most walls, they have like basically what's called a security nurse. So you're the person that hands out the cutlery, or the person that the patients will come to ask for things that are locked away because they can't have them because they're deemed dangerous or whatever, you know, like.
Yeah.
So, and then because I come from security, they would give me the security job. So, so it was quite similar.
You're multi-skilled, like.
Yeah. But obviously, the one difference was we had a lot more interaction with the patients. You know, so you build up a bit more of a rapport with the patients. You know, and you can
Build that relationship,
Yeah.
stuff.
And obviously, where before as security, you don't know what people are in for. You don't know what people are
You
in
do not
for.
background.
No,
You're
don't
just
know the
literally
background.
there
You
to
just get
escalate
called out,
situation.
John
Yeah.
starting, Joseph starting, or whatever. That's all you hear. You don't know what's gone on.
You deal with that half an hour, boom, done.
Of course, but obviously now you're dealing with, you know, you might have to sit in on meetings, or you might have to, go to court cases or whatever. The people might choose to tell you about their life and things like that. So now you've got a whole, you've got all this stuff, new stuff that you've got to take on and obviously process, and you've got to learn how to deal with it, and obviously answering back, and it was a bit of a change. It was a bit of a change, but I sort of half knew. I sort of prepared myself anyway, because as I said, I was a security guard probably for about 2 years, and I was going to a lot of emergencies, and I was learning, and I was talking to people, so I sort of half knew what to expect anyway. But it didn't prepare you really, expecting something and doing something is a totally different thing.
Been dealing with nurses, Porter, ACA,
families,
NHS stuff. So
you
yeah,
make phone calls to councils, or make phone calls to social services, families, all sorts of situations that you've got to deal with.
So is a mental health unit different than a normal ward? Like obviously you have a lot of mental health patient there with mental health issues. Like is something different on a daily routine? You still doing your observation, like changing and stuff, or
Yeah,
like
you're still doing your observations. You still do, like, obviously every patient there has to have their obs taken, meds prescribed, their needs met. You know, some have leave, some don't have leave. So obviously the ones that have leave, you've got to organise leave, and that could be ground leave where they're only permitted to walk the grounds of the hospital, or sometimes they have community leave. So obviously, because a lot of these people, they've got trouble with crowds, they have trouble dealing with people. So you also teach them how to, I suppose, mingle back into society. Show them that it ain't so bad walking around the high street going shopping. You're trying to show them it's a normal thing. But because half of them, they've lived this life for so long, they don't know no different. So it's a bit difficult to sort of, if someone's scared of the outside or scared of big crowd spaces, just dump them in the middle. What do you think's going to happen?
Yeah, of course.
It's going to be frightening. So your reintroduction, you'd be surprised how many people I've got to teach how to cross a road. They just walk out.
Yeah, I can
Don't look
imagine.
left, don't look right, or nothing. And you're thinking, wow,
Yeah,
So you're doing a lot of things for these people.
that can
A
be
lot of
tricky,
things. You're basically like, unfortunately, some of them are like children in their thoughts and in their processes. You don't expect adults not to looking crossing a road. But it happens. It's a shame, but
Wow.
hopefully, you teach them.
Yeah, you.
I mean, I've seen results, so I know that with a bit of a bit of encouragement and a bit of help, you might not solve the problems, but you can sort of show them that they can deal with situations.
Yeah.
They can do this, they can do that.
Cool. We jump to the next question. Like, so it's like, does mental health issues impact anyone, and how? Like,
Yeah. Mental health now is unbelievable. I mean, I think it's like you just got to go on the internet, celebrities and everything like that. It's definitely having an impact. I mean, when I started mental health 10 years ago, it was busy, but now it is off the scale. I mean, I don't know how we can deal with it officially.
yeah. Do you think sometimes the word mental health is a little bit overrated? Like,
What do you mean?
it's like, I don't know. Sometimes people simply needs to like,
Do I think that mental health diagnoses are given out too easily?
you think that?
100%. What I feel is it's easier to give someone a diagnosis than it is to look into the situation and find out what's happening. Give a diagnosis, because then you've got a diagnosis. We can treat him for this, we can treat him for that. Do you know what I mean? So, but actually looking into a situation, that costs money, that costs time. It's easier. I'm a firm believer in therapy. I hate medication. I think medication is absolutely disgusting, but it's cheaper to medicate someone than it is to actually give them therapy. Sit down, therapy. I'm a firm believer in it. I don't, but my hands are tied in a situation that because there is no therapy. We try so hard. There is nowhere. They've closed places down, or the waiting list is shockingly long, and you only get 6 weeks therapy, and then it's there isn't enough therapy. There's not enough therapists to deal with it. So I know why they go down the medication route, but I don't think it's a good idea, and I definitely think mental health diagnoses are given out like a medal.
Yeah.
I know I do. I know I really do mean that. I work with a lot of young people, and what it seems to me in this country, if you're naughty, you have to have a mental health problem. So naughty kids get treated for mental health problems, and
Yeah,
I don't.
that's
believe,
what I meant.
I don't believe that's the case. If someone's naughty, they're naughty. Doesn't mean they got mental health problems. But they always get tagged. I've met plenty of kids, and they're not mentally ill. They're naughty.
They're just simply naughty.
Just simply naughty.
Simply like in their like teenage
Yes.
age, you know.
Teenagers and mental illness are very similar. Very similar. So as I say, I work with a lot of teenage kids, and you've got to try and work out when it's their mental health or when it's them just being rowdy teenagers. And obviously, if it's their mental health, then you give them a bit of leeway. But if they're being rowdy teenagers, no, you have to jump on it, because unfortunately, in this country, 30 years ago, you stopped parents from disciplining their children. Against the law, you can't discipline your children. So what's happened is now 30 years later, you've got a generation of kids growing up who don't care. They don't care. Yeah. My dad used to look at us like this.
Can you imagine?
And we used to be quiet.
Different times.
Do you understand what I'm saying?
Yeah, it's different
I mean?
time completely.
So, this is the problem. When mental illness, especially amongst kids, mate, you think it's bad now. It's just going to rocket. In another 10 years, it's
back then, maybe parents used to give just a little slap, a little kick, like you don't do that anymore,
I mean, I suppose I'm coming from a different generation, yeah? So there's a difference between hitting your children and beating your children, yeah? Totally, you can't beat a child. You can't beat,
absolutely.
That's outrageous. But when I was a kid, we got a little slap around the legs.
Yeah, I agree.
And all that. Do you know what I mean? It didn't do me no harm. Do you know what I mean? I was never beaten. Do you know what I mean? Maybe once or twice. But on a whole, do you know what I mean? I wasn't.
You think that helped you? I mean,
100%. When I was getting these slaps, I thought they was unjust. But as an adult, when I look back on them, I deserved every one. I deserved every one. It's just that that's how my parents dealt with it. Do you know what I mean? You think my dad was born in 1942, so his parents were born turning the century. So you can imagine the discipline that my dad was brought up in, and then he obviously tries to install that into us. So we were brought up, I suppose, Edwardian style. Do you know what I mean? Like, we were given a whoop. Don't worry about that. If we got out of line, we weren't given whoops for no reason. Yeah, there had to be a reason behind it.
Yeah, of course.
So yeah, I think it's society. I just think it's everything.
Yeah, it's a bit changing. So now you are now currently working for one of the largest teaching hospital in London and in United Kingdom as a mental health support worker. Yeah. Can you just tell us that jump from a healthcare assistant to a mental health support worker, and what is different?
I suppose I've gone from ward work to A&E department. So
sorry if I stop. Now you currently basing as a full-time on a emergency department unit. Okay then.
So obviously on a ward, patients would be there long term. So you would see the same people every day.
2-3 months, like obviously.
Yeah, whatever the however long.
You build up more relationship with them and everything.
With now, obviously, we're getting people that come in who are having mental health crises, and obviously they will come in. They either turn up to A&E themselves, or the police bring them in on 136s. That's 136 of the Mental Health Act. So if you're in the street or you're anywhere in public and you're acting bizarre, you can be, you'll probably be detained under the 136, and that means you'll come down to hospital, you'll be assessed, and then they take it from there. You'll either be discharged or you'll be admitted into hospital. Do you know? So yeah, and obviously we have to we deal with different people every day. But the problem is, we have patients that come into hospital, they get assessed, they're coming in, so they've been assessed, so they're going to come into a mental health ward, but they end up staying in A&E for a week, like where they're waiting for beds on mental health wards. Shocking, unbelievably shocking. It's not fair for them. It's not fair for the patients. It's not fair for the staff who do honestly, I can't praise the staff that they do so much. You got to remember, you got mental health patients. They're standing for a week in A&E. They're getting angry. Yeah, so you have to deal with constant.
For a week in A&E?
Waiting for a bed. I mean, I've had three patients waiting over like 5, 6, 7 days in A&E.
In A&E.
Waiting for a bed to become available in a mental health hospital.
That's very bad, because A&E is the wrong environment, especially for mental health.
But because it's a place of safety, it's deemed acceptable.
Yeah, I mean, yeah, fair enough.
Totally unacceptable, but it's deemed acceptable, and the problem is then you've got patients getting frustrated, because they're not physically unwell, they're mentally unwell. So,
There
they
needs
could
to
be
be
agitated, they could be digi. So, they want to go out and you've got to stop them. They want section, you've got to stop them from leaving. Then you have to, restrict people's movements in the sense that they can't go for walks on their own. They have to go with staff. That winds them up. Then that potentially causes confrontation. Then having to fight people, literally, like people are trying to fight you. They're trying to fight you, but you're trying to restrain them. How you've been taught your techniques. Totally different. Do you know what I mean? If someone's coming at you with full fist, flaying, and you're just, oh, excuse me, I have to do my restraint. It's so hard work, But, oh well,
Wow, and let's jump to the next question. What type of question you ask to assess whether a patient require additional support?
See, what I find with mental health patients normally come to you. I can explain it sort of like when
They've already been assessed.
and if if they're not telling you everything, because it's just the way they act. I can't really describe it, but it's sort of like a way they act. And I always tell them, listen, there's no point telling someone half the story, because what a lot of them do is they've got stuff that they don't want anyone to know, and that's the stuff that's really troubling them.
Yeah.
So they tell people stuff that's troubling them, and they think that's going to be enough. But I say to them, no, you got to tell everything, because it will come back. You sort this problem out. This is the real problem. So you've got to tell the whole story. If you want to get help. If you want to be helped. But of course it's difficult, because some of the things that have happened or they've been through is horrendous. Do you know what I mean?
So, your job as a mental health support worker, did you have any previous? Do you need any qualification to do that job? You just simply need experience, or?
I mean, you do you do your testing, your tests and and your MVQs, and obviously the trust put you through the necessary
courses and everything.
Yeah. But it's not a uni or anything like that. It's not a uni or anything.
It's simply courses to attend or to
that
just do.
Mandatory training, and obviously some little courses and all that. Yeah.
So literally, your shift is simply looking after patient with mental health issues, and is simply just make sure they're safe and make sure they don't leave the hospital, or is there any other task you do?
Take their observations, write all that down.
So you do observation as well?
Yeah. Deal with them, basically deal with their needs, if they want anything, obviously you help them get that. If they want to go for walks, you go with them. If they've got wounds, you can help clean the wounds up, dress the wounds.
Yeah.
Some mental health support workers are trained in, doing cannulas, stitching, things like that. Because if you've got a patient who's self-harmed, and some of them are really scared, and you've built up a good rapport with them, and another doctor comes in to stitch them up, they get all freaked out. But if you can stitch them up and you've already got a rapport with them, you can get the situation nice and calm. Do you know what I mean? So it is, it's quite a...
Obviously, depend the patient, depend the situation, you just...
Absolutely, yeah.
Wow. And also want to ask you, if one of the patient is telling you, oh, I feel suicidal, what would you do?
So obviously, and which has happened loads of times, obviously, I have to tell them that, whatever they tell me, I have to tell other people. Do you know what I mean? I will go and speak to my nurse. But obviously, if someone's come up to me and said they're feeling suicidal, obviously we would explore with them, what's going on, what's gone on, if they need to tell us anything, and obviously try and help them calm down, understand the situation they're in, and then take it from there. But obviously, definitely talk to them. They won't be left alone or anything like that. And if we're really concerned about them, people get placed on one-to-one observations.
One-on-one observation.
Yeah, okay. So basically they have someone with them all the time.
All the time.
And obviously, if it's females, obviously we can't we can't say whether it's men or females that would be looking after the person. But if it was a female and then she had a man looking after, obviously she needs to go to the bathroom. She needs to be watched. Obviously, would be changed over for a female. So because the female would obviously have to go in and watch in case.
Inside the bathroom.
Yeah, absolutely. Because people hide things. You know, when people go out, when people go home on leave, they come back, and you're always finding.
They may have some like
Oh yeah, razors.
razor stuff hidden somewhere.
Yeah. 100%.
Wow.
Yeah.
What's your thought about like group therapy? You think would help mental health patient?
Yeah. See the thing. I think therapy.
Like a group therapy.
Yeah, group therapy, single therapy, whatever therapy. Because some people can't do group work. Do you know what I mean? Because they don't like being around too many people or whatever. I mean, that's a separate issue. Do you know what I mean?
Yeah.
But, that's confidence and things like that. But yeah, I definitely believe therapy. But it's the money. It's what it costs. Do you know what I mean? The amount of people that are now waiting for mental health treatment or mental health therapy.
Yeah.
Is mad. It's mad. You know, there's, as I said earlier, there wouldn't be enough people to do it. So that's why medication is the way. It's cheaper.
Okay, talking about medication, what your thought about like the medication used for people with mental health issues? You think they help them, or in a way, or like you think they could be? What's your thought about it?
See, it's a good question. See,
obviously, sorry, you're not like a nurse or doctor, so you may not have the skills. But what's your thought about? You think the medication help the patients, or they just?
I tell you what medication I know definitely don't work is antidepressants. Like we give people antidepressants and they're still depressed. Do you know what I mean? They're still depressed, and so that. People with schizophrenia, I mean, I've seen people with schizophrenia who have had, they might have stopped taking their medication, for example, and they're having an episode.
Yeah.
So they come into hospital because they're having a psychotic episode. We get them back on their medication and they're normal again. So medication definitely does work for schizophrenia and things like that. Do you get what I mean? But for PD, personality disorder, EUPD, there ain't no medication for that. There's no medication for that. That is where I believe therapy comes in.
Yeah.
Yeah. EUPD, PD is no, because all they do is give them antidepressants, but they're still depressed. I'm still seeing the same people coming in,
yeah.
self-harming, overdosing. The same people. Therapy. PD, EUPD, therapy. Schizophrenia and bipolar and things like that. I've seen people have bad episodes, get their medication back right, and they're back to and they're back to where they were before they had their mental health crisis. Do you know? So some medication definitely does work, but other medication don't work. That's my personal opinion. Do you know?
Yeah.
You know?
I want to ask you, how do you keep up to date into mental health field? Like obviously there is new technique on how to deal with patient. Every more we move forward with times. How would you stay up to date?
I must admit, I just stay up to date with basically what comes through online, on like the Trust's websites, and then any courses that I have to go on, and that's how I basically keep myself up to date. And I do look in, if there's new studies out that interest me, I will look into them. Do you know? I definitely, but mainly through my organisation.
Yeah.
Send us leaflets and and studies to look at and things like that. So.
Wow. Now now we got to the funny part. I want to hear some of your crazy story you remember, because as you say, you've been working as a security guard in a mental health hospital. Now you mental health support worker for any. I'm sure you went through crazy stories.
Mm-hmm.
And do you remember any crazy story and how you deal with it? And
oh my God! I mean, yeah, there's a few. There's one. I suppose the best one is we got this one on security. We got called out to psychiatric emergency on the kids unit. So it's kids 13 to 18, and so we got called out. And when we get there, they had snooker tables and all things like that. Obviously, it's a kids' unit, so they got things like this.
Oh, nice.
But
Nice
all,
setup,
but,
yeah.
they haven't no more after this situation.
There's more.
Yeah, so like we go there and there's sort of like 3 kids down there, 2 kids here, and they're all up to mischief. You know, one's trying to rip pipes out the wall, one's trying to hurt themselves, and the other 3 are throwing snooker balls at us. So literally, you got like snooker balls hitting the wall behind you, boom, boom, boom. So in the end, we had to pick up a table. Literally, me and my friend pick up a table and hold it in front of us.
To cover from.
Yeah, to cover from the snooker balls. So we're moving forward, and these balls just boom, boom, just hitting. When we got close, we didn't know what to do because we weren't going to pin the kids against the wall with a table. We're just protecting ourselves. We didn't know what to do.
You would, but you wouldn't do that.
Absolutely. But so as we got closer, they obviously thought they're going to pin us against the wall, and they ran off. So by then running off was good because then we could chase them, and then we could like restrain them, etc.
Restrain them,
things like that. I mean, that's one. But another one, there was a man. He was in forensic unit, and he was really, really nice fella. It sounds a really nice fella. I mean, he was one of the. I don't know whether you're familiar with the Yorkshire Ripper.
Yorkshire Ripper.
He killed about 14 women in like the 70s and 80s, prostitutes. He got caught. He was doing this for about 10 years, this man. He was on like 10 years spree. He got caught eventually anyway.
Okay.
And this man who I met in hospital, he actually attacked him in Broadmoor and like stabbed him in the eye, stabbed this Peter Sutcliffe in the eye. So Geezer was quite a a dangerous man, but he was a nice man. And how can you be nice? But he really was. And when he used to kick off, they used to be absolutely petrified, like literally, because I don't know whether you're familiar with a Yellow Pages. So it used to be
yeah.
This man could get a Yellow Pages and tear it in half.
Okay.
That's how strong this man was. He'd get a tennis ball, he could squash a tennis ball in his hand and split it in half. He was massive. So he used to kick off quite frequently. But he was good friends with my other security mate. And because he associated me and his friend, this man, he could have a table in one hand, and as soon as he see us, he would drop it, sit down, and talk to you like normal. Do you know what I mean?
He would behave like it. All right then.
Unbelievable. That's like the level of respect that he had. But this is the funny bit. But then I found that.
Wow.
Then I found that he was only nice to me because he thought I was black belt in karate. I mean, I wear a black belt. Do you know what I mean? But I certainly not got black belt in karate. So he literally.
He will behave.
Yeah, he could be kicking off. When he seen me, he stopped. And the only reason he stopped is because he thought I was black belt in karate. I don't know who told him this, or no one probably told him. He's probably in his head unwell. But I was quite relieved because I knew that he weren't going to beat me up.
Wow, it's crazy stories, man.
Yeah, but yeah, do you know?
And you remember that story you told me about? It was a judge, if I'm not mistaken.
So again, sorry?
It was a judge who had some mental health issues, and just tell a little about that story, please.
We got called out. Once again, got called out to psychiatric emergency.
Were you a security guard that time?
Was I security guard? No, I was working on the wards.
Oh, ACA, okay.
Yeah, I was working on the wards, and we got called out to a psychiatric emergency. Didn't obviously we don't know who it is until we go there.
Okay.
So when we go there, big man, big, strong. He got brought in by the police.
A judge brought in by the police.
Yeah. Judge, got brought in by the police.
That's crazy.
And he was unwell. I mean, he was like, you would how he was acting. You would not expect a judge. You would expect how he was acting with one of the people that he was sending to prison. Do you know what I mean? He was really unwell, trying to fight us, trying to bite us, everything. Do you know? So obviously we had to deal with him, restrain him, give him some medication, sort the situation out. Then it's afterwards that we find out, that he was
a judge.
He was quite a high, I think it was like a high court judge. But what happened was, he didn't stay in. Obviously, when the organisation found out, he got took out of hospital and got put into like a priory or something like that. He was just brought there because they didn't have nowhere to go. And then obviously, when they found out who he was, people in higher places, I suppose, moved him on to another place. I mean, I've met actors, pop stars.
Yeah.
Yeah, pop star. Yeah. Actors that just come in on a 136. They've been released pretty soon, but they've just been found like out of it, and they're acting all bizarre. Do you know? Yeah.
Wow.
Yeah.
Crazy stories, man.
Crazy, you know. Honestly, yeah. So
You remember that time when me and you, we had a shift together in emergency department, and we were having a break just outside A&E. And you remember we saw that patient, that young fella, try to escape.
yeah.
Can you just
Well,
tell that story? You tell them.
Well, like, as I said, like we was having a break, and obviously he's running through the departments, and he's kicked open the I found this out
The emergency
later.
doors.
He's kicked open the emergency doors, but obviously not knowing. Obviously, he didn't know that we were right behind it, so obviously we could deal with the situation quickly. Do you know what I mean? Obviously, you had to restrain him, take him back in. He's just a young boy, drug-induced psychosis, very, very strong. You know, very strong boy, and he was very unwell. So, and he was on maybe for about 3 or 4 days.
In A&E.
Yeah. Kicking off, intimidating everyone. You know, very, very unwell. He got, as I said, he got moved. He got moved to a ward, but it was quite challenging situations. You know.
You know, like when I was literally you went to, help the patient out, take him in. But I was there literally watching all of this happen. I felt like to be on a action movie for a second, man. I was like shocking to see that because I'm not based permanently in A&E. So, and what attracted me is the way you approach the patient. Like obviously, if you remember, he was kind of very paranoid. He was saying like, "Oh, you want to kill me, man? Don't kill me. You want to kill me." He just was saying something like this. And then you, on a very friendly, calmly manner, you approached him saying, "Oh, man, I'm your friend. I'm here to help you." But soon he put the guard down. What I like is the way you approach him from the back and you push him into the hospital.
This is the thing. I mean, the thing with mental health patients is that you've got to be calm in the situation. Inside, I'm shitting myself some of the times. Do you know what I mean? But you can't show that. Do you know what I mean?
Yeah.
Because a lot of times, I suppose it's like a dog. If they smell fear, they're gonna be all over you. Do you know what I mean? And this is what happens with mental health patients. You know, in their unwell state, if they think they can take a liberty, or they 100% they will. Do you know what I mean? 100% every time. They think they can escape, or they think, oh, they're not looking after me so well. I'll be able to run away from this person. It's difficult. It's difficult.
But like what made me think about was because obviously you hand over your colleagues saying, "Look, I'm going from a break, and that's the patient look after." But then we're having a break outside, and then you saw this patient escape. On that moment, I haven't seen any security or mental health support worker just chasing him. What that happened? Have you followed that up? And did you?
Yeah, see, unfortunately,
if you know what I mean, I was expecting like somebody else just chasing him.
All I can put it down to is some people. It's what people are prepared to do. That's all I can put it down to. Because you haven't got to chase anybody. You know what I mean? You can chase anybody. What do you put yourself at risk for? Do you know what I mean? It's like when they say, if you work in a shop and the thief comes in and says, "Give me your money," just give him the money. Don't argue with him. Just give him the money. So the mental health is the same. It's quite similar. If you don't feel comfortable or you don't feel confident, don't do it. Because if you're not confident or not comfortable, something's going to happen, and it's going to be worse. Do you know what I mean? So I suppose their thinking is it's easy, just let him go, which is terrible. I don't know. I don't agree with
it. So usually you're not supposed to chase him. I mean, it's not part of your job to chase him outside the hospital or outside the wards if he's escaped.
Once
you need to call security and then they need to grab him
as well. But if you can get them, then fine. But once they leave the hospital, then you shouldn't really chase them because it's dangerous more than
It's
anything.
off your hands.
Yeah, it's off your hands. It's dangerous more than anything.
Because I thought if he was able to escape that guy, you could end up dead on that day.
This is the problem.
You like literally saving his life in a way.
Yeah, maybe, or save someone else's life. Do you know what I mean?
Yeah.
So, you just gotta do what you gotta do. You know.
Wow. Did you follow up with your colleagues and ask him why you just?
No, I mean the problem
You
is
just alright, whatever.
see, the
You know how
problem
it
is-
works, and
Yeah, I mean, unfortunately, it goes down to like the nursing crisis. You know, there's not enough nurses, and they rely heavily on agency staff. And so, you've got agency staff who come to work. If they don't like the place, or they're going to be there for a shift, what sort of effort are they going to put in? They're going to put no effort in. If you work there constantly, that's your place of work, so you take pride in your place of work. But if you work there every now and again, you don't care. You're just there for a shift. Do you know what I mean? So it's very difficult if you're working with people regularly, then you can build up a team relationship. You can all
You're on the
agree with
stage.
absolutely. You all understand. You're all reading from the same sheet. But every shift, I've got to change the sheet because I've got new staff who don't know what they're doing, or they've never worked here before, or they don't feel comfortable. So it's very, very difficult. Do you know what I mean? Very
man,
difficult.
I want to hear some more stories. I know you got plenty of story, and I love your crazy story. Before we move forward, another crazy story.
Yeah, one more. Let me one more. Oh my goodness me! It's like when you think about it now, like put me on the spot. It's like wow. Do you know? I mean, one story. It's quite dangerous. This is we used to have a fella, and he used to dress up. He's like army gear, so he was very unwell man. He was fixated with the army, like literally fixated. He used to wear camouflage.
Was he an army guy? This one?
I don't think so. I just think he's just growing up. He would have been too unwell to join the army. Do you know what I mean? Mentally, so he's just obviously fascinated with the army.
Okay.
So he used to wear camouflage equipment all the time. So you used to see him walking around the hospital in camouflage equipment. But one time he went out and bought an air rifle, just an air rifle, and he's camouflage gear, and he's walking around the hospital with an air rifle. Right? Someone's obviously rung the police, right? And then, but the police haven't just turned up. You got like.
So this guy was simply walking around the hospital as a patient,
Yeah,
or
patient.
okay, he was a
He's been
patient.
given day release.
Okay,
So he's walking,
so he could.
he can go into town. Yeah, he's got day release. Do you know what I mean? He's
Okay.
not stopping him from going into town, but he's obviously purchased an air rifle. Do you know what I mean? I don't know, to do target shooting or whatever. He didn't shoot nobody with it. He was just, obviously he's in his camouflage gear. He wants a gun. You know what I mean?
Wow.
But of course, when the police are called, obviously all they get reports is of man with a gun and all that. So you imagine the SO, the gun police have come down and all things like that. And he's lucky he never got shot. Do you know what I mean? He's lucky. The only reason he never got shot is because obviously people knew him and said, listen, it's an air gun and all things like that. So yeah, that was quite hairy. That was quite hairy.
Wow, this amazing stories. But I think in order to do your job, obviously anyone can apply for mental health support worker job. But I think it's like you got the perfect physics to do your job. Yeah, I could have said like some, tiny person just do this job. I mean, I wouldn't think they couldn't manage.
You'd be surprised. I've seen little people. So see, the problem
you need to be like strong, and you need to have
that's
some
not always
physics.
true. I mean, I think it's how you hold yourself and how you deal with people and how you talk with people. That it doesn't matter if you're 5 foot or 6 foot. Do you know what I mean? If you talk to someone with respect and all that, and sort of, you can be small and still be I mean, I'll work with a nurse, Georgia. She's girl's tiniest girl in the world. I'll tell you what, she's told me off before and scared me. Do you know what I mean? So I'm 6'3". She's about 5'2". And she's giving me, she's like, she was my manager, told me off, and like, pop, like, whew. So if you can assert yourself in an appropriate way where people don't think you're intimidating them or you're being rude, I don't think you've got a problem. Do you know?
Yeah.
Yeah.
Before you told me like a patient gets stuck in A&E for like days, weeks as well, and before being moved, well, waiting for like beds in mental health hospital. What was the reason why patient gets stuck, even if they're ready to go?
No beds.
No beds.
Simple as that.
And why there is no beds? Like, it's because there is no funding for home care, or for like.
Yeah, I suppose that, the community. Once again, the community package, the community team. I don't think it's worth the paper it's written on. Personally, do you know what I mean? It's not very good. I hear countless people complaining about the community teams and all that. But I suppose it's not their fault. Once again, they're overstretched. They have so many patients. You know what I mean? You can't. It's impossible to deal with everybody. Do you know? It's impossible. So people slip through the cracks. It's countless. You know, there's so many reasons why.
Because obviously, some patient needs to go to mental health hospital, but some of the patient can go home, and or they're like some more like care homes.
Yeah. So sometimes they just go home to their normal home, but their community team will take up their case. So the community team maybe call them up twice a week, or might arrange to come round their house, or give them phone numbers to people they can call up if they're feeling stressed. You've got that crisis line in places like that. So some people just come in because they're feeling a bit anxious. Because someone's anxious, they mean they need to come into hospital. Just give them the crisis line number, and they can.
They don't need it to be in a hospital or stuff like that.
No, they can just talk to people. They don't, if they're not feeling, if they feel uncomfortable, or they feel a bit anxious. Sometimes people just need someone to talk to.
Yeah.
Because they might not have anyone to talk to.
Look, I've been working with you, and what like attracted me of you was like you're not just there to do what you're supposed to do, your job, but you're very, very, you're very helpful. You're an excellent team players. I saw you like doing jobs around, helping moving the bed, even if at that moment you're not busy, or that's what I like of you. You're very multitasking and an excellent team player. I want to ask you, obviously, as a mental health support worker, you go support by a band 5 mental health nurses. Sometimes I think you don't need to be a nurse to do that job, if you know what I mean. Like, I don't know. When I was in Brighton, I used to work in Brighton General Hospital, and I never seen like mental health support nurses. Most of the one-to-one or dealing with patient mental health issues, they were like the ACA.
I think what it is that maybe it's the area. London's bigger than Brighton numbers, and also the amount of people that. Well, I think basically why these roles have come up is because there's been so many deaths in A&E.
You think so?
100%. Like people. See, mental A&E's a busy place. Nurses have got to deal with Mr. Jones with chest infection, Mrs. So mental health patients get sort of get left. So this is why these roles have come up. So this is why we're dealing with the mental health patients. It frees up the nurses to do their other roles.
Yeah, the reason I'm telling you that is because you don't need 3 years university to be a nurse in order to do one-to-one for patient, to look after patient.
No.
Yeah, don't you think it's like a waste of taxpayer money? Somebody do 3 years university, just go there, do one-to-one with patient. Don't you think it's like
they could give it like a band 4, for example. I think that's what they're trying to do now. They're trying to get band 4s. It's like band 4s couldn't give medication before, but now if you do the test, you can give medication. But so you're basically a band 4 that can prescribe medication. So they give medication. So you're basically doing a nurse's job, but they're paying you a band 4 wage. Do you know what I mean? That's basically what's happening. So they're trying to lower the grade, lower the banding. So basically get a band 4 to do basically a nurse's job, but pay them band 4 because they just say nurses are band 5, band 6, whatever. Do you know?
I mean, I understand it, but I just didn't see. Obviously, I don't have the skill to literally give my opinion, professional and everything. But I don't think there is literally the need to put a band 5 to do that job. You know what I mean?
The NHS, there's lots of things that I don't understand with it. Do you know what I mean? That's why it's hemorrhaging money the way that it does. Do you know? So.
Yeah, thing is there, yeah. Wow, I mean, it's NHS. We obviously there's time for improving. Obviously, it's not a perfect institution, NHS. It can always be improved and everything, you know. Just before we finish, I would like to ask you, if somebody looking forward to do mental health support worker job, or looking forward to, you know, to studying to do your job you're doing right now, what advice would you give to somebody who want to do this job?
Patience is a must. I mean, it can be very, very, very stressful. So patience is probably number one thing that you must have. But it's very rewarding job. It's very rewarding, as I said earlier, when you see people that are unwell, and then you see them at least at a standard where they can get back to normal. It's great. Patience, working like within a team, you know, being a team player is very, because like you do rely on your team, like you rely on your people that you work with a lot, you know, quite a lot. You got to remember, these people could potentially save your life one day. Do you know what I mean? You know, you're dealing with an emergency, and you know, so you know, it's good, you know, to be able to get on with people. Listen, you work colleagues, you're not always going to get on with everyone. Do you know what I mean? That's normal. Do you know what I mean? But as long as there's a respect there, I work with people I don't like at all, but I respect them. Do you know what I mean?
Yeah.
There's a difference. Do you know what I mean? You haven't got to like someone to respect them. Do you know? Do you know? So, yeah. So patience and being a team player, and I suppose listening, and you know,
Important skill too.
yeah.
And also hit the gym, because it can be challenging.
Say again?
And hit the gym as well.
Yeah. Cardio.
You may need a
cardio
little-
is a must. I mean, I do restraining now, and afterwards I'm like, oh my god, fucking heart's ripping out my chest. Yeah, cardio.
Shall do some gym for free, yeah?
Yeah, I'm telling you, yeah, absolutely, yeah, of course.
All right, Mr. Steven, thank you so much for being here today.
I hope that was all right.
Literally, it's been a pleasure talking to you, and thank you everybody to listening,
Thank you.
and have a good time. Goodbye,
Cheers,
everyone.
goodbye.